Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 389,775 confirmed cases of COVID-19 in Canada and 119,922 cases in Ontario. Chatham-Kent has 515 cases and Sarnia-Lambton has reported 413 cases. Michigan now has 373,197 cases, with 20,843 cases being in Detroit. Today we are reporting 63 new cases of COVID-19 in Windsor and Essex County. Of the 63 new cases, 13 are close contacts of confirmed cases, 3 are community acquired, 2 are agri-farm workers, and 45 are still being investigated. We have had 3,801 cases since March. 3,304 cases are now resolved, and 415 cases are active and being followed by our health unit. 22 people are currently in the hospital, and 5 people are in ICU. Our community has lost 82 people to COVID. 56 deaths have occurred among residents in long-term care and retirement homes. There are currently 19 active outbreaks in Windsor and Essex County, 5 in long-term care and retirement homes, 7 workplaces are an outbreak, 3 schools are an outbreak, 2 community outbreaks, and 2 hospitals are an outbreak. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick. Limit close contacts to your household, the people you live with. Keep a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering indoors, outdoors if physical distancing cannot be maintained or if wearing one is required. Avoid touching your eyes, nose, and mouth with unwashed hands. And cover your nose and mouth with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID exposure app at canada.ca. On a final note, we are working with the Ministry of Labour and other local enforcement agencies about their planned workplace safety campaign on Friday and Saturday, and we will provide an update early next week on the results of that campaign. Since November 1st, our tobacco and vaping officers have laid 10 charges, 5 in the hospitality industry, 4 in retail, and 1 in personal care. Please continue to visit our website at wechu.org for further information and updates. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us. I don't have a written speech today. I do feel that our case counts continue to increase every day, and as well, we reported 63 cases. There's a number of information that we have been putting out for our education, for educating the public. The key emphasis continues to be the number of close contacts. The cases that we are seeing is more and more happening within close contact, and the number of people, number of close contacts that everyone is having is continuing to increase, and this is evident with respect to our outbreaks that we are seeing right now. 19 active outbreaks in a region like this. It's pretty significant with many workplaces involved. Involves a lot of time for all of us to go through with many blitz and many activities that are happening from an enforcement and education perspective. We'll continue to work on it, and we'll continue to ensure that the workplaces and other businesses are following the guidelines and ensuring the safety and well-being of not only their staff but also their patrons. But as community, we always we also have a responsibility in terms of how we are visiting these places and ensuring that all non-essential trips and activities are minimized in our community. Thank you.
We'll now take questions from the media. Today we'll start with Blackburn.
Yes, good morning. I guess just, you said you were going to provide details later on this workplace safety campaign. What can you tell us? Is it more like an enforcement blitz for workplaces?
It's an education and enforcement campaign, so it has been done in other areas such as Waterloo, and we are going to be working with the Ministry of Labour for our area this tomorrow and this weekend.
So you'll have additional staff that will be going out and visiting workplaces throughout the city and the county?
Our tobacco and vaping enforcement officers will be joining them.
Okay. Anywhere like specific or any field specifically, or just any businesses that may be open and workplaces that may be open?
There is a plan that has been outlined, and I'm not sure if they've disclosed that, but we'll let the Ministry of Labour take the lead on any further information because we are partnering with them on this initiative. But we were consulted and have been collaborating on a joint campaign.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. I have a question about the current lab capacity for our region. Do you have a sense of how quickly lab results are coming back, even if it takes the health unit longer to get to notifying people?
So we are getting results back within 24 hours to 48 hours. The kind of a barrier in the processing of the test is it is taking up to 3 days to get an appointment at the assessment centers now, and also with the increased capacity of the decreased capacity of our staff to notify people in a timely manner, and then the ability to get the results. So all of that combined, there is a little bit of a delay in people getting tested and then getting their results at this time.
Okay, so the health unit receives the results within approximately 24 hours. Would the person be able to check their results online within that time frame as well?
So as soon as they're posted, the person would get to check their results online, and often the person will know even before our health unit reaches them. So that can happen where you check your result online and you're aware of your result. So if that's the case and we haven't reached out to you yet, stay isolated, monitor your symptoms, and you will hear from us.
And then finally, just on this topic, we have an individual telling us that they were tested on Friday and they have not yet seen their results online. It says they're still pending. What should an individual do in that situation?
So the results are still pending.
They've basically been waiting almost a week, and based on what you're saying, that shouldn't really be the case. Is there any avenue that this person can go through to get the result?
I'll turn this over to Dr. Ahmed.
Thanks, Taylor. I think they can obviously connect with the assessment center and find out what's going on. We can also sometimes have the ability to follow up with the labs, and I think that's not the general trend. But generally speaking, we get there may be some instances where there may be issue with mislabeling of the specimens or something like that. But for that individual, short of how to access the results, I think what I would say, depending on the type of exposure or the concerns, if there is any concerns, if there's any symptoms, they should treat themselves as a probable case in this situation and stay isolated until they hear otherwise. And as Teresa mentioned, sometimes there may be some delays, and connecting with the assessment center, maybe they will be able to track that specimen that when they shipped it, or if there's any issues with that.
Okay, thank you so much.
Any questions from AM 800?
Yeah, good morning. I'm just wondering, I've seen a lot of questions on social media, people looking for clarification on what it means to have a community outbreak. I know that there's 2 right now at Victoria Manor and River Place residence. So would a community outbreak, be declared anywhere that there's, like, are we talking like these 2 facilities on like other like high-rise apartment buildings and stuff like that?
Yeah, it could be any unregulated settings, such as even when we declared the outbreak at the university residence, we call it a community outbreak because technically there is no overseeing agency that is ensuring all of these things and responsible for residents. So in all of these three places, there are a residential space which people are using to stay, but otherwise they're fairly independent. They come and go, and so any type of setting that can happen in the residential homes, private facilities, those type of outbreaks are classified under the community outbreak.
And second part to that question is I did have someone reach out to me on social media wondering why in those community outbreaks you are not listing the number of people who have tested positive.
I'll have to get back to you on that, but generally we do report that. I'll have to double check if there's any reason that why we're not putting that number for that. So stay tuned, we'll get back to you.
Okay, thank you. And just quickly going off of, I think what Taylor was talking about and the testing, and I think Teresa had mentioned that now it's taking up to 3 days for someone to get an appointment. So do you foresee this testing system changing again and maybe going back to having to wait in line, or will you be advocating that to the ministry or anything like that, just to speed up the process so people aren't having to wait like 72 hours to get a test?
Well, part of the pressure would be that the hospital is in an outbreak as well. So I think as things resolve in the hospital, the access to the assessment center and having more staff will decrease those wait times. So the booked appointments are now booking 3 days. We do have an arrangement with the assessment center that our health unit can refer and directly there if needed. So we will continue to work with them, but I believe it's the pressure of the current outbreak. And then as we improve our contact tracing here at the health unit, that'll improve that as well. So I think there's a couple things in play right now, but hopefully they all get resolved very quickly so we can give people access to the testing and their results.
And I would imagine also that some of the added pressure would be from these school outbreaks, because every time a cohort is dismissed or something happens with one of the schools, the people that have been notified are being advised to also go get a test, and they're being given priority, correct?
Yes, so the assessment center's been working really well with us to accommodate the students, and that is taking a while. If a cohort has been released, it's all based on the timing of the test, so we do recommend that they wait to day 5 or day 7, and we indicate that in their letter. So it's not always that they're immediately needing the test. Unless they have symptoms, then we're always saying, get tested. So there is a little bit of a little bit of time to, they should, if they're dismissed, book your test right away because it will take a few days. But typically we'd want you to wait to day 5 or day 7 to get tested if you've been a dismissed cohort based on a high risk exposure.
And is that just to give the virus, I guess, time to present itself if it is there?
Yes.
Okay, thank you.
Any questions from Radio Canada?
Yes, good morning. So my question is for Dr. Hamid. We were looking at the data this morning and we realized that there seems to be very few COVID-19 cases in the Windsor-Essex Francophone schools. So is this really the case? And do you have any specific data about that? And what could explain that?
So I didn't catch the last part of your question, but you were right. The data that we have mostly from the schools is from the public board and from the Catholic board. We do not have any confirmed cases in the French boards yet, to my knowledge. We do track absenteeism data from each of these schools, and we have worked with those schools, French schools in the past as well, with their plans. And we do get in touch with them every time when we need to communicate and talk about the safety of the schools and the school system. So if you can repeat your last part of your question, maybe I can try and answer that too.
Yeah, I was just wondering, what could explain that? Because
our school board, do they have the obligation to report any COVID-19 cases to the public health?
Yeah, so I'll pass it on to Teresa to, maybe she has more information than me.
Well, one of the French school boards did have a group of students released. That was earlier on. And so we do work with them. They have the same responsibility or requirement to report cases. And so we do work with them. And I believe there was one school early on. There might have been a couple, but I know for sure one.
okay, thank you.
Any questions from CBC?
Hi, yes, good morning. I'm wondering about the time frame that it takes to get a hold of cases and contacts, because the Ministry of Health wrote to me a statement and they said that Windsor-Essex continues to reach more than 96% of cases and more than 89% of contacts within 24 hours. But that's not reflective of what we've been hearing from you, that in some cases it takes a few days. So I'm just wondering, are these numbers from the ministry dated, and which is the correct time frame?
So we do, we submit the data to the ministry, and I do have last week's statistics here, and I'm looking at this is for contacts, and I have 1 day notification is between 70 to 97%. It ranges by day and the number of cases we have. And within 2 days, it's about 80 to 98%. So the issues, some of the days, and it seems like Saturday seems to be a very heavy day for our staff. And so if they're not notifying everyone on Saturday, it's carrying over to Sunday. And both of those, both on the weekends, we've had reduced staff. So that's where the delay has been. It seems it's been that Saturday in the last few weeks. But overall, they do the average. And we are doing well, but I know that we have had to move over cases from day to day, and we're getting a better handle on it, but I think we need a few more days to see. This report actually would have stopped on November 29th, so it was just November 23rd to the 29th, so we'll see what the 30th, this past week brings, but the numbers do look good, but we know that what we're seeing internally is some of the carryover from day to day, which we don't like to see. We want to be able to say that we've contacted every case within the first day or two, and I know that hasn't always been the case of recent.
Okay, thank you. My next question is for Dr. Ahmed. The Minister of Health said yesterday that there are, and you said this as well, that discussions are ongoing between the province and the health unit about potentially moving into lockdown. The minister said that Dr. Williams has already or would be asking you, Dr. Ahmed, if you think the region should go into lockdown. So I'm just wondering if that conversation has happened yet, if you've been asked by Dr. Williams, if you think it would be a good idea, and if so, what have you told him?
So I think at this time, we are obviously looking at the data, and we're also trying to understand the impact on the community with respect to community transmission, as well as the healthcare system pressure that we are seeing across the region, whether we are talking about the hospitals or the public health. We do have lots of plans in place, and Teresa did talk about some of the additional supports that we are getting from the ministry. A lot of those things will be in place as we speak, or even as soon as early next week. We have been sharing all that information with Dr. Williams' office, and we've been in contact with them. We haven't had that specific conversation yet whether we should or shouldn't go to lockdown. I hope to have that discussion once we had the chance to look at our data for 1 week, which is coming very quickly for us. And would like to see where this is going, but also we understand the impacts that it would have in our community when we are talking about the lockdown, and trying to find that right balance, and giving that opportunity also to some of the measures that have been in place. We moved into red zone on Monday, so technically today is Thursday, just 3 days into the red zone, and with very strong restrictions in place. And typically, and I've said this before, unless we have strong evidence that things are not improving, we like to take action very quickly. But not having a very set criteria at this time, I think we would like to see some results of the additional restrictions first before we go into the lockdown. But again, those are some of my thoughts, and I haven't had that fulsome discussion with Dr. Williams at this time. I hope to have that conversation soon, and we'll discuss it in more detail.
And are you reserving the right to make the call about the lockdown on your own locally if needed, or are you waiting to be in agreement with the province on this after, as you said, you've analyzed all the data?
Well, I think it works both ways. Obviously, Dr. Williams or the ministry, they can only look at the number. They may not have all the information of where these cases are, what the pressures are, and the distribution of these cases. So even when you have, let's say, a large number of cases, but they're all linked to an outbreak, which we have already tracked down, and we know who is impacted, the extent of the outbreak, and if the outbreak is adequately managed, we may not have the same concerns, but the data may show us a different direction. So I think we do have the ability to initiate it locally, and then the province almost always, when they're looking at the data, then they need to know that information before they move forward. And then they can initiate, and then they can make some suggestions that, this is what we're seeing, and we do feel that, things are getting worse, and we feel that you should go into lockdown, or you should go into this, and then they're looking for me to make a case of not doing that. And if I have the data to support that, no, we should not do that, then they listen, and then they make a recommendation accordingly to the cabinet. Or in other cases, we can be the one to initiate that discussion to say the data is getting worse, we're concerned about this area, and we really want your support and guidance in it. And then they guide us, they walk us through with some of those additional information, and then we collectively we come to some kind of an agreement that, yeah, it makes sense, or it doesn't make any sense.
Thank you.
Any questions from CTV?
Yes, it's Ricardo here. Good morning, everyone. So for Dr. Ahmed, I'm focusing more on schools today. We're seeing some, I guess, questioning from parents as to what's different now from March in terms of schools staying open or being closed. Some are wondering why schools aren't closed if we are seeing cases and outbreaks declared. I guess if you could explain, the difference between then and now, and why schools wouldn't be closed as part of a lockdown, as indicated under the gray category.
That's a good question, Ricardo, and nice to hear your voice after a while. But the biggest difference would be the preparedness piece. When in March, none of the healthcare system, the community, the public health system were prepared to deal with this pandemic. With the schools closed for a number of months in early part of this year, it did allow us to look at the evidence, look at the data, look at the impact of having the school open versus closing the schools, and ensuring the safety of the schools too. So there's a lot of work that happened to use all the evidence, use all the data to make that decision. Obviously, there is no risk-free option, and I've been saying that if I have to say that there is no risk, I would be lying. There's always a risk every time that you're coming in contact with people. Same idea is when students are coming together, there is a risk. What the key piece that happened was, how do you mitigate those risks? How do you make sure that you are minimizing the risk? Because if you're not sending your kids to school, there is a risk. You are putting them at a risk of, and putting them at a disadvantage of not able to go through the learning process, to stimulate their brains. They are young mind, they learn a lot, and any delay in learning, it puts more pressure on them. People have different styles of learning. A lot of the students may prefer the online learning. A lot of the students would not want online learning, and they would only learn better in person. There's a lot of other human social element that goes into learning when students are in a classroom setting. So all of those measures are put in place to provide that level of protection in the school system. What we are seeing right now is that fine balance of not only providing the education to the young minds, but also trying to balance the risk of contracting COVID or being exposed to someone with COVID. Most of the cases that we have seen in the school system, other than the outbreak that we have declared, is the cases are brought into the school by students from their home. And the index case has almost always been a family member who then in turn infected the student, and then the student in some cases was attending school, results in dismissal of the cohort. So that has been the typical pathway, and overall that has been the trend in other regions as well. And I can completely understand the anxiety and concerns of parents when they're looking into it and trying to find that balance. But it is important that, just like our initial messaging, we talked about it, that every parent have to make that decision for themselves, and finding what is better for their children, and what kind of risk that they're willing to take to find that right balance. Not everyone have that option. We definitely do not want to create that inequity issue as well by not by giving only, let's say, saying that yep, everyone should be studying online or everyone should be studying from within the school setting. Because people need option. All those options are there. There are a number of steps that we have taken. There are a number of measures that the school boards have taken, the ministry have taken to ensure the safety of the school. So we'll continue to review those process. There's a lot of learning that we are doing from our Begley school outbreak, and also the outbreak at the other school. So we are learning every day, and we are incorporating all those changes. We want to find that right balance. We want to keep our schools safe and to provide an environment where all these bright young minds can engage in learning.
So it sounds like you're saying a lot of the transmission is happening outside of school, not happening inside of school. If that were to change, if that trend were to flip, would that then maybe rejig the thinking a little bit and potentially put us closer to closing down schools again?
Yeah, definitely. I think that does require some discussion, but also thinking about that there is a dedicated ministry, that there's a dedicated program and campaign that's happening through the Ministry of Education to keep the schools safe. So it would be more of a dialogue and a discussion to make sure that we're all on the same page and ensuring the safety and well-being of the students. So that's the first thing. But to the other part, definitely, if there is more evidence that because of the school environment, because of anything, the cases are increasing, then yes, that could be a trigger for us to maybe either try to address that or mitigate those risks if possible. If not, then in the interim, if we have to take any immediate measure, we would, just like we did with Begley when we were investigating. We did find that there are some areas of concern that forced us to make that decision of shutting down the school. And mind you that even when we shut it down, we were not expecting that many cases, but we did had some evidence initially to suspect that there's a lot more going on behind that we need to get a better handle and to ensure the safety of the students. So we did that. If we get that evidence again from any other school, I will not hesitate to shut down the school again. But we have to follow the data. We have to follow the evidence. And as I said, everyone has different priorities, different level of risk tolerance, and every parent have to make that decision for their own children and make a decision that would balance the risk of not putting them at a disadvantage of not educating them versus ensuring that what kind of an impact it may have if for any reason their child, God forbid, contracts COVID.
And last question, in the Toronto area, we're seeing, school-wide asymptomatic testing. Is that anything that you would, or is that something you would consider carrying out here in Windsor-Essex?
So that's something that Teresa and myself, we talked about that, and we're also initiating that discussion with the ministry too, to see if this is something that that we can leverage and use that. But if you recall, just a couple of questions earlier with Christy Lee and also with Taylor about the testing capacity and the pressures, there's all of that, and I think. As much as we want to support everything, we'll have to ensure that the system is ready and able to respond to it. But short answer, yes, I would be interested, but we'll have to find the right way, right timing to do that.
Awesome, thank you.
Any further questions from Blackburn?
Yes, just going back to the testing capacity. When the employment base started, we had two assessment centers, one at Ouellette and the other at St. Clair. Are there any discussions about opening a second assessment center? I know they had talked with one at Windsor Regional Hospital. Is that one still just dedicated to school students at that time? Is that still open? What is the status of that?
So right now it's not open. The only assessment center in Windsor area is the Ouellette campus. They did, Windsor Regional Hospital did open up the Met campus to support for the additional demands for the school outbreak. And as Teresa mentioned, right now they're also having an outbreak and having some staffing pressures and challenges there. Definitely a conversation worth having with the hospital system, but again, not trying to say that we don't care, but generally Ontario Health leads the testing strategy and campaign, and they are the one who make some of those decisions. And when I'm saying Ontario Health through the hospitals, they make some of those decisions. But definitely, some of this pressure that we are seeing, it is making us think and asking us to have that discussion with Ontario Health, with our hospital partners, to look for additional capacity if possible. But again, we'll have to put all of those things into perspective given everything else that's been happening in the community.
I mean, what's the concern there? I feel like waiting 3 days just to be tested and then waiting another 2 days after that, you're waiting 5 days. I mean, and hopefully people are self-isolating, but if they don't have symptoms, they feel fine. I mean, to me, that's concerning, but what is your concern there that, the wait time just to get tested is 3 days?
No, I absolutely agree with you, Maureen. I think we want those test results done in a timely manner, and getting us the results in a timely manner is also critical. And it's not only an issue of whether the person is following those recommendations or not, but it also allows us the ability to do contact tracing and contain the disease. Because if we're not containing, or if we're getting the information late, that means the contacts either have spread it to other people, and then it just has a ripple effect throughout the system. So we'll definitely be talking about additional capacity and see if Ontario Health and our hospital partners have the ability to support more testing in the region.
Thank you.
Any further questions from the Windsor Star?
Yes, in terms of testing, I know the health unit has said in the past that once somebody tests positive, there are systems in place to make sure that they are in fact self-isolating. But are there any systems in place to ensure that people self-isolate once they've been tested and are awaiting any results?
So it's tough because the number of people that are going through the assessment center to provide them with the instructions. They give them a sheet that how do you self-isolate while you wait for the test results. But there is no way to ensure that they are actually self-isolating. If we get some complaints or concerns, especially if we have an EPI link, so for example, if we know about a case and we know that this case resulted in 3 close contact, which could be at risk of developing, and if we have any evidence that if any of these contacts are not following those, so our team reach out to them, and in some instances we have issued section order just to make sure that they continue their isolation for the safety of the community. But by default, I think it's difficult right from the initiation that when someone is going to get tested, doesn't necessarily mean that they will have the disease. So we'll have to find that right balance. And but they do get information from the assessment center right at that time that they must self-isolate until they get their results back.
So it makes sense that the resources to police every person that gets a test don't exist. And then separately, Doctor, today you didn't have a prepared statement. I'm just wondering, does it sometimes feel like you run out of things to say, that you have said everything that you can say to people?
You read my mind, Taylor, and I think there's not a lot of tool in my toolbox to come and talk to the community about what to do. I think we've been talking about it. We've been trying to dispel any of the myths. We've been trying to answer any misinformation that's out there, and maybe people don't understand, don't get it, that what kind of an impact it may have on people who are personally impacted by it, and there are many of us who have been personally impacted by it, and again, just trying to share my personal side of the things as well. One of my close friend, he lost his father to COVID. And it all happened because of, these close contacts. So people are dying, people are losing a lot of things. Young people developing severe disease, people in their 30s, people in their 40s, when they're infected, it's very hard for them to even breathe or to imagine. It almost feels like they're dying. Those are the real stories, real concerns that people are experiencing right now. And as boring as it sounds, or as I've heard people that they cannot live life like that, but ask someone who is impacted by it and how they are living and how they're struggling and what motivates them to follow those instructions versus not. It's not as benign as many people think. It could be benign, a lot of them, but when real people, when they get infected, they develop severe complication. One other story that I was watching, I don't have lots of evidence because it was in the news, that our intelligence agency, CSIS, have been now are finding evidence that the misinformation there are specific campaigns, there are countries involved in spreading misinformation everywhere, even in Canada. So don't fall into the misinformation. Listen to what we have accomplished over the years and years of science and everything that we have gone through. I've spent 28 years of training and education combined to to be here to guide us, to lead us, to provide you with the best scientific evidence as possible. Our team, every one of us have spent 20 plus years to provide you with that information. So it's not that we are following blindly. It's not that we don't know what we're doing. It's unfortunate that when we are dealing with this type of pandemic, we don't have lots of tools. We're doing risk communication. We are trying to educate our community. And it's time, I think, we all recognize our responsibility to ourselves, but also to our community.
Thank you, Doctor.
Any questions from AMA 100?
No, thank you very much.
Any further questions from Radio Canada?
Yes. So for my next question, I would like to go a little bit further on one of the issues that we discussed yesterday, Dr. Hamed. You mentioned that the Windsor-Essex region is facing unique challenges in schools and with the border. So is it possible to have more information about that? How does the border affect the management of the health crisis in the region right now? And would you say that there are maybe currently more COVID cases related to travel to the US compared to the first wave? So I would like to hear more about that.
So good question. And one of our unique challenges, we don't have all of that data. We don't have access to all of data. I don't have access to how many people are crossing border every day, whether they are truly healthcare worker, what kind of workers they are. In Canada, we define essential workers differently than what is defined in the US as essential workers. So the number of people that are crossing border, it essentially increases the risk. So in our local community, we are asking people to stay home and to limit their activities, to limit their going out to any of these businesses only when necessary. There is a letter of instructions that is issued by me for businesses to look for virtual options, for people to work from home. We are right next to a community, to a state in US, and the state of Michigan has the case count which is similar to the entire country of Canada. We are right next to it, and most of the cases in Detroit, which is in excess of I guess I forgot the exact number, but just the difference is huge between U.S. Detroit versus in Windsor-Essex. And when people are crossing border, there are people who are crossing it for the right reason, and there are people who are just crossing it for the sake of crossing and doing still what they used to do before. Because once you're there, there is no one who's tracking you. And once you're back, without even knowing who's coming back, whether they're following or not following, we are living in that information gap. Personally, I would like to see more strict control on who's crossing, and recognizing that in the first wave, there were some unique challenges with our Detroit healthcare system in general, because we know that 1,500 or more than 1,500 healthcare workers cross border to support their healthcare system. I get that, and I respect everyone who's crossing there, but that doesn't mean that everyone who's crossing is a healthcare worker and is crossing only to support the healthcare system. So we need to get a better handle on it. Especially as we are coming close to the holiday season, we'd like to see very strict control on who's going in and going out of the border. Because unless we do that, everything that we are doing locally, it won't mean anything. Because if the community has people who are going into areas with high disease transmission and they're coming back, and if they're not following any of those quarantine measures, because the other aspect is there are certain not everyone receives a quarantine order when they're coming back in town, because if they're a daily commuter, if they're deemed as essential workers, they may not get a quarantine order, and then they may go out there and they do what they normally would do and put everyone else at risk. So we don't have all that information, and that really is concerning in terms of the flow of people that are crossing the border every day, and we need to get a better handle on that.
Okay, and just as a follow-up, you also mentioned earlier this week that the Windsor-Essex County Health Unit is the least funded per capita in the province. On what data did you rely to make this statement? And I was also wondering, so when you said that your health unit is running out of resources, are you asking for more response to the province, or it's more about sending staff to help, for example, with the contact tracing?
Sure. So we don't have data that actually supports that we're the lowest funded any longer. That was something that was released several years ago by the ministry. There hasn't been a similar report. We do know that in recent years we have had an increase, and throughout this pandemic, though, we have had support from the province and continue to access support. So early on, well, not early on, but the ministry has provided 19 nurses to our health unit, which were dedicated to school nurses. Our Board of Health in July approved the hiring of 22 additional people. We hired successfully 20 of those people. One was recruitment for an associate medical officer of health. That was not successful, and so we have we're using some of that money for a director that we've brought up from a management position to assist with some of the work at the management level. And recently, the ministry has provided us with 23 contact tracer supports who just started this week. There's 2 teams, one 11 and one 12 people, or is that doesn't add up, but 11 and 12, yeah. And they're going to support the contact tracing, and in addition, we're working to get 5 case investigators, and this is where primarily our nursing pool have been assigned, is the case and the contact management. So with the help of the province, we are addressing some of our some of our issues with staffing, and I think we talked about this earlier this week, that all of that should get us back on track. Our numbers continue to be very high, though. So again, today with 61 cases and all of those contacts, we know that each of our cases right now may have 2 to 3 contacts per case. So with all of the existing, staff, we've redeployed staff from many areas, and I just looked at our, I developed a little spreadsheet, and I think we have 133 people dedicated to COVID, and about 51 of those are specifically for case management, and now again we have the 23 new people for contact management. So that's quite a large amount of people dedicated just to the cases and the contact management part of it. And there's lots of other people supporting different aspects of the pandemic. And I've mentioned this as well. Our public health inspectors, when there are outbreaks, and we have quite a few in our community, they're out there in all of these facilities supporting the long-term care, the workplace, the schools. So there are a lot of people dedicated to COVID to get us through this.
Okay, thank you very much.
Any further questions from CBC?
Yes, I just wanted a quick follow-up on the enforcement campaign with the Ministry of Labor. I know you'll share more information soon, but can you share what prompted this campaign? Is it because of the number of outbreaks we're seeing in workplaces, or has there been, an increase in the number of violations or complaints that you're seeing?
I think this was a strategy that was employed in other health unit regions earlier on, and we had become aware of it and inquired, and then it kind of started, the partners came together, and it looks like Friday and Saturday are our designated time, but there were other health units that had actually had this campaign going, and with some success, and we we're now in red. At the time, I believe we were in orange when we had the initial discussions, but or maybe even yellow. I'm not sure. It's been a little, I think a week or two, and things are moving quickly.
And just a quick follow-up to that as my last question. Have you received any, or can you quantify the number of complaints you may have received within the construction industry about workers not wearing masks? Has that come up?
I don't believe we've had complaints about that we've reported. I've gone through the complaints. We do have, I'd have to double check on that specifically. Our tobacco and vaping enforcement officers would know exactly. There are a lot of complaints that have come forward, but I don't know specifically about, that sector. So I can check that.
Okay, thank you.
Any further questions from CTV?
No, thank you. Have a good day, everyone.
Thank you, everyone.